Thank you very much. Good afternoon, everyone. Let's get going with the provincial numbers. 4,400 added today. It's been an uphill for the last couple of days. We are now, again, looking at record numbers in Ottawa, for example, over the weekend. Toronto, Peel, York, still getting high numbers. And our region is no exception. We continue to have increased cases. Over the weekend, we actually added 101 cases, if I'm not mistaken, 107 cases, 25 in Cornwall, 34 in SDNG, and 48 in Prescott Russell, and an increasing number of school-age children that we were getting. Just to give you context, in terms of our numbers, we had in January, 170 school-age children positive. February went down to 34. In March, we went up to 96. And in April, to date, we were up to 99. And so that's one of the reasons that we were worried about schools. And as you know, the school announcement was made today about schools not reopening for face-to-face learning after the current spring break. And I will talk a bit about that later as well. If we look at our rolling average, again, we're still up there. Cornwall sort of in the 146 range. We're still way above the red here. And so again, it looks like we're stabilized, but we are getting sort of these increases and we're still not having a clear tendency downwards. However, again, perhaps we can hope this will be a trend moving that way. What I just wanted to also share was that with our contact tracing over the weekend, and because I asked our contact tracers, like, where are these coming from? Most of them are family gatherings for Easter, and this is exactly what we're seeing right now. And so moving forward, one of the things that we were worried about obviously was kids now home, and again getting together and then going back to school with even higher rates. So I do agree with the school closures. As a matter of fact, I had spoken to Dr. Vera Etches on Friday morning, and both of us were in agreement that if the province was not going to move to close the schools, we would. Not because the schools are unsafe. I want to repeat that again. We believe the schools are safe. They have the precautions in place. The problem arises is that the more you have in the community, the more it'll pierce into the schools, and the more it will disrupt the schools. I've had to close down 7 schools over the last week, and that's not because there were multiple outbreaks or multiple cases in the school, but that were related. But we had several schools, for example, that had multiple cases that were not related at all. They came from different families, different classrooms, but the disruption that was being caused by the isolation and the testing and all the things that we were doing, particularly because it's VOCs, we really had to close them down. So for operational reasons, if we were to reopen the schools next week, presuming that the high rate of positivity and rate of positive kids would increase, we would still have these on and off, closing school here, closing school there, isolating a class there. So I am in agreement with that, although I am a true believer that we should open them as quickly as possible when we will reevaluate this. And my estimation is that we will evaluate this on a weekly basis. I don't think that we'll see a big change between this week and next week. So into next week, as we have the first week off with closures, for example, not the spring break, that's when we'll start to see it. I am also hoping to see a bit of a flattening of our curve and downwards as we see the effects of the stay-at-home order. Again, can't stress enough that the stay-at-home order has to be followed. The less we are mobile, the better it is for us. It's really it comes to that. And you've heard our hospitals are overwhelmed. We have 7 ICU patients in our hospitals as well. A couple of them are in their low 60s. One is in the 51 ICU admissions, and at this point we've got 7 in our ICUs. So it's very important to continue really to adhere to these public health measures. We don't want to overwhelm our system, and it will give us time to vaccinate more people. In terms of our outbreaks, the good news is that there's 2 that have declared over, McConnell and Sandfield. We have one remaining one, St. Joseph Continuing Complex Care. There's a couple. There's some residents there, but again, the others have no residents, and so we're getting a decrease. That's good news because we vaccinated most of those places, so we're getting a decrease in those as well. In terms of vaccines, that is also a good story to tell. Again, we over the weekend we had our first real large mass immunization clinics. We had one in Rockland and one in Castleman, in Cornwall at the the big, very nice Benson soccer dome. Each clinic vaccinated 1,000 people, and we are on track to continue with 8 clinics like that a week across our area for the next 4 weeks. We're expecting to have more vaccine allocations given to us over the next week or two. Most of our spots between now and May 7th, the first week of May, are booked. We had about 34,000 spots available. As of today, about 30,000 spots were taken. We do know we have some good news as well in terms of the pharmacies. It's although it doesn't look on the website, but we have been working, and I must thank Jim McDonnell for helping out. We have been trying to get some pharmacies in Cornwall. Initially, they were going to put one, but we were going to get 2 in Cornwall. Stay tuned for the exact address, and we're going to get another one in Rockland. And so far, so we'll have 6 in our area administering AstraZeneca vaccine. We have one in Hawkesbury, we have one in Embrun, we have one in Winchester. We'll have 2 in Cornwall and one in Rockland. And I'm told as the AstraZeneca numbers increase, there'll be an increasing number of pharmacies receiving it, and it'll be akin to the number of pharmacies that receive influenza. And there's multiple, there's about 20 or 30 at least in our area. So that's good news. But again, we're just waiting for the vaccine supply to come. The other thing that we're doing as well is we're actually providing vaccines to our primary care so they can start vaccinating their patients primarily with high-risk chronic disease. And so that's moving well in terms of the numbers. And like I said, hopefully we will have vaccinated another at least 35,000 individuals between now and the first week of May. We're up to at least 32,000 now. So that brings us in the 65,000 range of people getting their first dose in our area, which I think is very encouraging. Again, I'm hoping if the numbers increase into May, we'll be able to do even higher numbers in that regard. And so again, we're just going to continue working. Again, we're fighting between the increasing number of cases. And by the way, in our area, our VOCs are about 72%. And in terms of provincially, we're in the top 10 of number of cases per 100,000. And we're in the top 5 of percentage of VOCs that are that are a part of those positives. So again, we've got to be careful. And I'm hoping that with what we're moving forward, staying at home will have a decrease in the cases, and that way, as we reevaluate that, we'll then be able to reopen the schools as quickly as we can. Again, we're trying to have schools to be the last to close and first to open. And again, for operational reasons, I believe that it was the right move by the province. And as I said before, if it wasn't the province that was going to do it, I was going to do it myself with a Section 22. Donc, bonjour tout le monde. On va commencer avec les chiffres ontariennes. En effet, ce n'est pas des bonnes nouvelles. On a eu 4400. Il y a un cas ajouté aujourd'hui. Ça fait quelques jours qu'on est dans le 4000 à peu près. On voit toujours les cas augmentant à Toronto, Peel, York. Ottawa avait un record ce fin de semaine. Aujourd'hui, il y avait 339 cas. Et nous, dans notre région, il n'y a pas d'excès. On suit à peu près le même trajet. On peut voir ici que nous avons, cette fin de semaine, nous avons ajouté 107 cas et encore 25 à Cornwall, 34 à SDNG et 48 à Prescott Russell. Je peux vous dire qu'on a eu pas mal des enfants entre 4 et 18 ans. Juste pour vous donner un exemple, Au mois de janvier, on avait 170 cas. C'est pour ça que les écoles n'ont pas ouvert. Ça, c'était encore post le congé qu'on avait au Noël. Février, on avait 34 cas. En mois de mars, ça a augmenté à 96 cas. Et jusqu'à date, on a eu 99 cas des enfants de l'âge scolaire dans notre région en mois d'avril, les derniers 10 jours à peu près. Donc, vous voyez, ça commence à augmenter. Et ceci est la raison pour laquelle je suis d'accord avec le fait que le gouvernement a fermé les écoles après cette congé d'avril qu'on va avoir. Et je veux clarifier que si ce n'était pas pour le gouvernement de le faire, je le ferais moi-même avec une ordonnance de section 22, mais ce n'est pas nécessaire actuellement. Ce qu'on va faire, c'est qu'on va suivre les chiffres de façon de proche, semaine par semaine, et on va faire les décisions semaine par semaine. Je ne crois pas qu'on pourrait qu'on va voir beaucoup de changements avant la semaine prochaine. Donc, on va faire ça semaine par semaine, espérant qu'avec la nouvelle ordre de rester chez nous, les cas vont diminuer. Je veux souligner aussi que au niveau des écoles, les écoles sont encore secures. Ce n'est pas une question qu'on a une propagation importante dans les écoles. Qu'est-ce qu'on voit? On voit les taux communautaires tellement élevés que ça rentre à l'école. Et au moment que ça rentre à l'école, ça cause beaucoup de disruptions. Ça cause vraiment de déranger les opérations. Il faut isoler des classes, il faut isoler le personnel. Et ça donne beaucoup de défis opérationnels. En effet, la semaine passée, j'ai été obligé de fermer 7 écoles dans notre région. Donc, si ça continue comme ça avec les cas augmentant dans les régions, avec une hausse de transmission dans la communauté, c'est sûr et certain qu'ils vont rentrer à l'école. Donc, c'est pour ça que je supporte le fait qu'on ferme les écoles. Comme je dit tantôt, je le ferai moi-même quand même. Oui, je suis le premier à dire que c'est très important d'éviter les effets secondaires qu'on peut voir, non entendu, aux enfants qui restent à la maison. Il y a plusieurs problèmes qu'on pourrait avoir. Mais de notre côté, je suis le premier à dire c'est le dernier à fermer et le premier à ouvrir. Donc, espérons que semaine à semaine, on pourra avoir une diminution avec les cas dans notre région pour qu'on puisse avoir une diminution de transmission communautaire. Et ceci va diminuer les cas qui rentrent à l'école. Je veux souligner que ce n'est pas une question que les cas se propagent dans l'école et ça vient dans la communauté. Ça vient du communauté et ça rentre aux écoles. Donc, je voudrais être clair avec ça parce qu'une fois que ça rentre à l'école, c'est très rare qu'on a des occlusions. C'est très rare que ça se propage aux autres enfants. Par contre, les variantes sont très, très transmissibles et je peux vous dire aussi que 72% de tous nos cas positifs sont dus aux variantes. Et aussi, nous savons qu'elles sont plus faciles à transmettre et ça cause un peu plus, ça cause des admissions, comme vous voyez, les hôpitaux sont chargés. Dans notre région, nous avons 31 dans l'hôpital, dont 7 sont soins intensifs, incluant une personne à 51 ans. Donc, c'est très important de continuer de diminuer les cas premièrement pour diminuer les admissions aux hôpitaux et aussi pour nous laisser ouvrir les écoles le plus vite possible. Donc, au niveau des flambées, deux flambées sont finies. Celle-là de McConnell Manor sont déclarées finies, aussi Sandfield Place. Et les autres, on n'a pas beaucoup d'autres au niveau des maisons des aînés, sauf on a 4 cas positifs des résidents au St. Joseph Continuing Care à Cornwall, mais les restants ne sont pas des résidents au niveau des occlusions. Donc, on va passer au niveau des vaccins. Ça, c'est de meilleures nouvelles. Cette fin de semaine, nous avons commencé nos gros cliniques d'immunisation Moins, une à Cornwall au Benson Center et l'autre à Jean-Marc Lalonde, à Jean-Marc Lalonde à Rockland. Ça a très bien été. On a vacciné 1000 dans chaque clinique. Ça a bien été. Nous avons des cliniques bookées, cédulées d'ici la première semaine de mai, 8 par semaine. Ceci égale le débit qu'on va recevoir. Et nous allons à peu près avoir vacciné 35 000 personnes. Donc, on a 35 000 de places de vide qui étaient disponibles. Maintenant, il reste, je pense, on est rendu à 30 000. Il y a quelques mille qui restent pour des rendez-vous, bien sûr 60 et plus. Et aussi, on va continuer à vacciner. Il faut dire aussi qu'avec les pharmacies, ce n'est pas officiel encore, mais il va y avoir un rajout de 3 autres pharmacies qui vont avoir l'AstraZeneca, une Rockland et 2 à Cornwall. Initialement, il faudrait donner juste une à Cornwall, mais je pense qu'on a besoin plus qu'une à Cornwall, mais on va avoir 2. Mais on va ajouter au fur et à mesure, aussitôt qu'on a un débit. Et, comme je dis la semaine passée, ce n'est pas notre choix. C'est une décision qui est prise par le gouvernement, mais avec l'aide de nos MPP locales, Jim McDonnell, on a été capable d'avoir 2 à Cornwall. Je n'ai pas encore des dates de commencement, mais ça va très bientôt parce qu'ils ne sont pas encore sur le site web. Au niveau des autres vaccins aussi, on donne, on va donner des vaccins aux médecins primaires et aux cliniques des centres communautaires, etc., pour qu'ils puissent commencer à vacciner leurs patientes avec les maladies chroniques, comme prévu dans la deuxième phase, avec le risque plus élevé. Donc, on est toujours dans une course, si vous voulez. Si on continue à vacciner comme ça, puis on compte tous les doses, là, on est rendu à plus que 31 32 000 de données. On peut donner une autre 35 000 d'ici la première semaine de mai. Et à ce moment-là, on aurait vacciné à peu près 65 à 67 000 personnes, première dose dans notre région, qui est pas mal, nous, qui est à peu près 40-45 % de notre population. Donc, ça, c'est des bonnes nouvelles. Et si le débit commence à augmenter, en mois de mai, on pourrait vacciner beaucoup plus de gens dans la même période de temps. Donc, j'aimerais aussi prendre le temps pour remercier tous nos partenaires communautaires à Cornwall, à Rockland, à Winchester, à Hawkesbury, à Alexandria, à Castleman. Juste que j'ai oublié quelqu'un. Nos 6 locales, en effet, nous avons la collaboration exceptionnelle de toutes nos personnes, des doubles personnes. On a des bénévoles qui travaillent de façon étroite, de façon dédiée, et ça fait du bien de voir ça, parce que ça nous aide beaucoup en donnant le vaccin. Donc, je vous remercie tout le monde. J'ai oublié de le dire en anglais, je vais le dire tantôt en anglais pour remercier les gens aussi. Et c'est vraiment un travail communautaire et je suis très contente qu'on a ce type de support dans notre communauté parce qu'ensemble, on va le faire. Ensemble, on va le faire. So I'm just going to look at some questions. Before I take the questions, I just wanted to thank our multiple partners. We've had very successful clinics in all our 6 areas, in SDNG, particularly in Alexandria, in Cornwall, in Winchester, and then in Prescott, Russell, Castleman, Rockland, and Hawkesbury, all these cities, all these municipalities, and multiple volunteers, particularly over the past weekend in Cornwall, exceptional volunteers and help. It went very well. 1,000 people went in very smoothly. We can probably do more. The reason is we don't have enough. We're just doing it based on our vaccine supply. Same thing for Rockland as well. We had tremendous support. Most of the people there were volunteers and people in the community helping us, and it was a very good experience, and I'm very grateful to all personnel, all municipalities, all partners, all volunteers for helping us. It's a community affair, and as we do it, the more we can do it, the quicker we can get the people vaccinated that want to get their vaccine. So I'm just going to go to questions right now. The first two questions really have to do with school break, and I've answered those. Another question that I had from Nation Valley is about the Pfizer vaccine and the South African variant not being effective. Yes, I am aware of that. Although the good thing is that we do know with these mRNA vaccines, we can add and modulate and give boosters that will give additional protection. As far as I know, and what I've seen in the latest statistics, for the UK, which is the one that's circulated the most in our area, and for the Brazilian one, the current vaccines that we have are still quite effective. So that's the good news there. I talked about the pharmacies and so on. And then I have another one about Moderna delayed. No, the Moderna delay will not affect our clinics. One of the fatalities that are for outbreak related, no, we have not had any fatalities in people that have been vaccinated in any outbreaks. And that's it. So I will go to questions, Jenna.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Thank you.
Hi, Dr. Paul. The number of pharmacies in the region that will offer AstraZeneca vaccine didn't increase a lot in the EOHU compared to Leeds, Grenville, Lanark, which added 22 pharmacies. We're adding 3-ish, I guess, so making it 6. Do you feel that we're being underserved by this?
I have raised it. One of the things that they're trying to do is they're trying to catch up with the numbers. When we were receiving vaccine, Leeds wasn't. They were a month behind us. So it has to do with the total allocations. At the end of the day, the numbers will average out.
Okay, and so far, with the new stay-at-home order and the shutdowns and that, have there been many compliant issues?
Not that I know of, but I do know people are asking a lot of questions about what they can do, what they can't do. If you were to ask me, if you ask me a question, I would say, is it essential? If it's not, don't do it.
All right. And just lastly, again, back on vaccines, do you have a timeline yet on when the EOHU is going to be operating a vaccination clinic in South Dundas? Because there are no pharmacies. There's 3 ready and waiting to go.
Yeah.
There are none. The vaccines are available in North Dundas and in Cornwall, and this is a bit of a desert here.
We're working on it.
Okay, but no date yet.
Hard date at this point, but we are working on mobile and other solutions as well. That's why I'm very disappointed at least we don't have the pharmacies there yet.
Okay, thank you.
Thank you.
Next question, Thomas Stockton, TBC 22 asks, health units in BC are starting to assume all cases are VOCs rather than waiting the time and wasting the money for the specific testing. With the EOHU at 72% VOCs, is this something you are contemplating?
We treat all cases as VOCs.
Do you know which?
We're not waiting for the, sometimes the VOC screen comes a day or two later. We assume it's VOC until proven otherwise.
Do you know which pharmacy in Rockland will be receiving AstraZeneca and how can residents book?
I'm not I had it down here somewhere. I'm not sure which one. It'll be in the website very shortly. We will share it on our website. I'm not sure there were 2 initially, but there's one now, I know, but I'm not sure which one it is.
Thank you. Next question, Nelson Zandbergen, Nation Valley News. Please go ahead.
Oh, hi, Doctor.
Hi.
For employees in workplaces where, and this is going to become more of a phenomenon, where some have been vaccinated and some have not, the ones who have been vaccinated, is it appropriate for them to tell their colleagues, look, I don't need to wear a mask anymore, I'm vaccinated, and no?
No, it's not appropriate. At this point, we still want everybody to take the same precautions. As we have more people vaccinated with both vaccines, we'll be able to take those liberties, but not before that.
Okay. I've also heard from someone who has received the vaccine in the first phase in March, and they're wondering about when they're supposed to get their second. It's kind of unclear to them. They're supposed to use the pre-registration system, but nobody gets back to them. How do they know if they're actually being targeted to get their second dose in time?
They should have had a notification. If not, they will get a notification because we have a system that will pop up the names and will notify them. So if they haven't heard anything, call the health unit and we'll make sure. But and moving forward, most of them do have an appointment already booked.
And just finally, in terms of the deaths, is that the only silver lining for the third wave? Is like the first wave, we had the highest deaths. Second wave, the peak didn't quite reach what the first wave did. Now we have similar numbers of cases as the second wave, a little higher, but the deaths are way down from the second
Yes.
wave.
That is the silver lining. And that's a tribute, I think, to the fact that we vaccinated the elderly. And I was looking at it. It's funny you should say that because I was looking at the epidemiologic curve from the ministry, and you can actually appreciate the difference when you look at the case. There's a different graphs. One shows just the cases going up, the first wave and the second wave, and then you saw first wave deaths going up, second wave deaths going up, and then the third wave the deaths are sort of flat, very, very low. So yeah, I take great comfort in that. However, we still are getting deaths, and we're still getting younger people in the ICU and sicker with these variants. So although yes, the deaths are down, I'd like them to be nothing. They went up by 15 in Ontario today. 15 too many.
Thanks, Doctor.
No problem.
Prochaine question, Annie-Rose Deschâtelet, Le Droit, c'est à vous.
Oui, bonjour, Dr. Paul. J'avais une question, en fait, par rapport au communiqué que vous avez émis le vendredi soir pour les surdoses dans la région de Cornwall. Ça fait quand même plusieurs fois là, que vous émettez un communiqué avec la police de Cornwall par rapport à l'augmentation des surdoses. Est-ce que c'est juste un rappel que vous faites ou si c'est vraiment encore une fois en augmentation dans la région?
Non, c'est encore une fois qu'on a eu parce que nous avons un groupe qui fait la surveillance à travers de notre région, et quand on voit une excédence de plus que la moyenne, on fait toujours un rappel en partenariat avec la police aussi pour vraiment faire que les gens n'oublient pas que ceci est un problème qui existe et qu'on a beaucoup de héroïne, beaucoup des choses qui sont toxiques et heureusement, on n'a pas eu de décès, mais on a eu l'augmentation de débit de cas qui se présentent à l'urgence. C'est pour ça.
Puis là, justement, évidemment, là, vous l'avez rappelé plusieurs fois au cours des derniers mois. Est-ce que le BSEO a fait quelque chose de concret pour peut-être essayer de renverser la tendance?
On travaille on a une coalition qui travaille au niveau de toxicomanie. En effet, nous avons des partenaires qui nous aident dans ça, mais c'est une chose qui est, à mon avis, un effet de la pandémie, et on travaille avec plusieurs partenaires pour commencer à aider et aussi donne aussi l'information, parce que malheureusement, il y a certaines substances qui ne sont pas reversées par Narcan, donc de naloxone, par exemple. Donc, on travaille avec des associations ciblées qui travaillent avec ce type de personnes.
Merci beaucoup.
Pas de problème.
Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you. Merci.